Hey everybody, I'm going to give people a chance to come in. This is kind of important. Don't get into things, Rose. The evil cat. Just waiting for people to come in. It's telling the followers I'm live. I don't want to have to go back over information, so I'm just going to wait for a couple people to mosey on in. Hey, Michelle. Yep, okay. Definitely, I'm happy I have you here. Because you're one of the people who brought this to me. And then you can correct me if I screw up part of the story. But still waiting on people to come in. Like, hey, I'm live. Hey, Betty. It's not that late. Okay. Still waiting. Madeline should be here shortly, I know. I want to talk today because the CDC released new guidelines on quarantining. And Michelle brought up the problem with that today. Okay, somebody that's in their community, very prominent figure, volunteers all the time. He came into contact with somebody. And when you come into contact with somebody, they wanted you to stay home for 14 days. Okay. Problem is, after his quarantine is when he started to show symptoms. So he was negative in the beginning. Even though he was exposed, he tested negative. Did his 14-day quarantine and was not tested afterwards because it's not in the guidelines. So what happened was he did develop symptoms and he did become contagious, and then he got sick after his quarantine. So currently, who needs to quarantine? This was prior. People who've been in close contact with someone who has had COVID, excluding people who have had COVID in the past 3 months, because we know your antibodies at least protect you that long. People who have tested positive for COVID-19 do not need to quarantine or get tested again for up to 3 months, as long as they do not develop symptoms again. People who develop symptoms again within 3 months of their first bout of COVID may need to be tested again if there is no other cause identified for their symptoms. What counts as close contact? You were within 6 feet of someone who has had COVID for a total of 15 minutes or more. You provided care at home to someone who is sick with COVID. You had direct physical contact with the person. You hugged or kissed them. You shared eating or drinking utensils. They sneezed, coughed, or somehow got respiratory droplets on you, which is why it's important to have a droplet-covered mask, which HCA did not supply. Steps to take. Stay home and monitor your health. You stay home for 14 days after your last contact with a person who has had COVID. So this individual did that. He was tested negative. You're not going to test positive right away if you come into contact. The virus has to have time to replicate in your body, and you can't detect that on day 1. Watch for fever, cough, shortness of breath, or other symptoms of COVID. If possible, stay away from others, especially people who are at higher risk for getting very sick from COVID, which he did. And then went back out into the public because he was told to. He was clear. Well, with the new CDC recommendations, this gets even scarier. The Centers for Disease Control will soon issue new guidance cutting the quarantine time for people exposed to COVID from 14 days to 10 days. So he would have been out in the community sooner, spreading it asymptomatically, because they're not required to test you after quarantine. Do you see the problem with this? Very easy to see, isn't it? Because we're spreading it this way. And just 7 days if the person has tested negative. So he would have been out even longer in the community. Because we're not testing after quarantine. It's not recommended. It's not required. You don't need it, is what we're told. Well, yeah, we do, because of situations just like this. This man followed every direction because he's a prominent figure in the community, volunteers everywhere, and did not want to infect anybody. Am I right so far, Mickey? The revised recommendations are expected to be announced tonight, which is tonight, and are based on a range of new data on the virus's behavior compiled by the agency over the last several weeks. The CDC briefed Vice President Mike Pence and White House coronavirus task force officials on the decision today. Pence had pressed the CDC for months to revisit its quarantine guidelines. Guys, politics has no freaking place in this virus. It needs to go. The medical professionals need to be listened to, and you need to leave the CDC the hell alone and quit putting pressure on them, because they're not even making an announcement. It's going in a damn magazine. Politico magazine is where I'm reading this from. Do you see a problem here? Yeah. This is not a political problem. Masks are not a political statement. No. And I'm going to read some study results after this. Pence, let's see here. The move comes amid rising concern with the Trump administration and among public health experts about whether Americans are growing less willing to follow strict public health measures, even as the crisis continues to worsen. Had we not made this a political statement and divided the damn country over a freaking mask in the very beginning, this wouldn't be a... Would you get out of the cat food? You have a whole 2 bowls over there, Rose. But had he not done this and encouraged people to, and taught people how to do things safely, and not made this such an issue, we wouldn't be here right now. Folks, there are not enough of us to go around. There's not. In the very beginning of this, we had Seattle, New York, and some other major cities that we were able to travel to. Look at the outbreaks across the country. They're still deploying to Texas because there's not enough people. We have the beds. We don't have the staff. And we need to slow this, and this became a political problem over a freaking mask. And now we're lessening the quarantine guidelines and not testing after quarantine to see if people are positive who were negative in the beginning. So now they're not quarantining long enough, and they're asymptomatically spreading it in the community. Problem. This is a huge red flag here. So the CDC did some peer-reviewed epidemiology updates. Would you stop? Oh, she's playing with her toy. Never mind. I'm sorry. Children. So they did a few studies, and they're all peer-reviewed. This one was posted on October 23rd, factors associated with mental health disorders among university students in France confined during the COVID-19 pandemic. So they did some risk factors of the female, gender, or non-binary, low-quality housing, history of psych follow-up, symptoms compatible with COVID, social isolation, and low quality of media information received. Do you hear that? Media information received. Our media should have been spreading facts and education and not fear and dividing people over this damn virus. We're still not talking about RLF 100. So they talk about the methods, and let's see here. Implications are the prevention, surveillance, and access to mental health care services are important for university students, particularly women, non-binary students, and those with a history of psych follow-up. And I know people from all these groups, even the non-binary. Talk to them every day, damn near. We interact. Great person. But they're at risk for mental health issues. They suffered suicidal thoughts, severe distress, stress, anxiety, and depression, which is going to relate to trauma and PTSD in the future. Because, he did become asymptomatic after quarantine, I do believe, because of the dates. I explained that. Only after he was off quarantine. Yeah. So that's the problem. If they would have required a test after quarantine, we would have known he was positive, but he was negative in the beginning. We don't have any uniformity on this testing, folks. It's left up to the states to individually talk about, and they're going off the CDC guidelines. But if we're not testing afterwards, and they were negative in the beginning and positive now, that changes the whole quarantine time frame. Do you see the problem? Incidents of COVID-19 virus transmission in 3 dental offices, a 6-month retrospective study, which it's retrospective, not as good as a double-blind and all that, or a randomized controlled trial. But in those 3 offices, no occupationally acquired infections were identified among staff involved in the care of 2,810 patients that often included aerosol-generating procedures. No patients reported COVID symptoms 2 weeks after having an aerosol-generating dental procedure. I am in a position as a respiratory therapist that I am around aerosol-generating procedures just like they are. suggesting no transmission from office to staff patients. Now, obviously, that's just, and this was between March and September in New York. So we were in a hot spot. That does have some weight to it. Using enhanced infection control measures. All patients were contacted 2 weeks post-procedure to determine whether they experienced any symptoms. 3 staff members contracted COVID during the study period while furloughed. A family member was the source of infection for all 3. The limitations, and that's nice that they put this in here. Small study sample, and patients may have been asymptomatically infected. So they could have been, because of the masks that the dental hygienist and the dentist wear, they could have been exposed to a very low amount of the virus and not tested positive or had symptoms. Completely possible. We know this. We wouldn't know unless we tested everybody. Teresa says that her cat loves watching me. I'm just a cat person even through the damn... Hi, kitty, 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 kitty. I love that. Thank you, Teresa. I needed that. She sent a picture of her cat watching her laptop. It's freaking adorable. I love it. But, so there is that limitation. These are on the CDC website. I'll share them on the Facebook. I can't really share links on Instagram. So there are limitations to all that. So there's another one, effectiveness of adding mask recommendation to other public health measures to prevent COVID infection in Danish mask wearers. Man, I get dry. So 42 participants in the mask recommendation group were diagnosed with COVID compared to 53. So it was 1.8% compared to 2.1% in the control group. But what they didn't do, let's see here, infection diagnosed through self-collected specimens for serology and PCR. PCR is the standard right now. That antigen test, we're going to talk about that in a minute. During the study, mask use was uncommon in the community. There was no official recommendation for mask wearing. Other public health prevention interventions were recommended, and community prevalence was 2%. Limitations of this study, they were self-reported primary outcome data. 46 self-reported mask use, did not assess the role of masks in source control. Unblinded study could not control for disinhibition or increased risk taking from wearing a mask. Study designed to detect 50% decrease in acquisition of infection and not powered to detect smaller differences in transmission between arms. Implications. While this trial of mask wearing suggests that masks do not protect the wearer from SARS-CoV-2, here's the important part. Emphasize that it neither addresses mask wearing as a source control nor definitively shows that masks do not protect the wearer due to 46% adherence to mask wearing. The group points out that the limitations of using antibody tests with specificity of 97.5% as the primary measure of infection in the study. There's another limitation. It doesn't tell you the viral load of the individual who was infected. Did they have a small viral load? Did they have small amounts of the virus in their system when they tested positive? Or were they exposed to a very large amount and did they come down with severe symptoms? Another limitation, but the study wasn't looking for that. That's important. When you look at these things, you have to, that's why I do the education, folks, to teach you what to look for. That's important. Risk of severe COVID-19 among workers and their household members. This is an important one too. Key findings, 49.7%, 123.2 million of U.S. adults met the main CDC increased risk guidelines for severe COVID-19. And 151.3 million met the broader guidelines for increased risk. 27% who met the main CDC guidelines were essential workers. Hi. And who could not work at home. I wish I could. 56.7 million, which is 46.1%, either lived with or were themselves essential workers who could not work at home using broader CDC guidelines. This increases to 49.1%, 74.3 million. So the method used was data from a 2014 to 17 in-person household survey of U.S. civilians that provided information on health and employment was used to assess the prevalence of the risks among adults who held essential jobs and could not work at home or lived in households with such workers. Broader guidelines added smoking, asthma, and hypertension to these risks. Limitations, it was pre-pandemic data, may not reflect current employment and work-at-home status. Implications, policy related to reopening and vaccine distribution should take into consideration not only the health risk of essential workers, but also those with whom they may live. So that lets us know who the individuals are who need to be reached first with the vaccine. There's one on telemedicine. I'm going to skip that because there was some major changes. Obviously, we know we're using telemed just fine. We should probably start to move towards that. Another thing with Health 3.0, let doctors determine what's best for their patient. If they can do the telemed at home, why do they need to come in the office and expose themselves to more viruses and risk? So we can use that data in many other ways. There was another one down here. Convalescent plasma and severe pneumonia. Key findings, at 30 days, there was no difference. Remember, this is severe patients. RLF is my only freaking hope right now. Damn it. At 30 days, there was no difference between the convalescent plasma. Rose, get out of the... Hang on a second. She's got her head in the bag. What are you doing? You want to freaking starve me to death, you goofball. I figured that would be Worf. Damn. There was no difference between the convalescent plasma and placebo groups in clinical outcomes. No significant differences in clinical status were seen at day 7 or at day 14. There was no significant p-value, okay? That means that the plasma is not working in my critical patients. I need you there early. Please do not delay your care. This is one of the reasons why. Overall mortality was 11% in the plasma group and 11.4% in the placebo, folks. It doesn't work. This is why we do studies. Everybody wants to have the next best thing, but when the data comes out, was it really the best thing for you? No. Quit pushing for things that we haven't studied. Let us do our job. Rose, for the love of God, stop. Or I'm bringing it in here. She's probably all stoned on catnip. That's why she's acting up. Give me that damn bag. I swear to God. There. I have to listen to her crinkle it in the background. So this was between May 28th and August 27th. They did this at 12 sites in Argentina. But really, there's just we've seen no great data. Now, the monoclonals, we do know early on are helping when you come in early, but not in severe patients. Limitations, conclusions cannot be drawn regarding efficacy of plasma therapy earlier than the median time of entry to this trial or in patients with milder disease. Milder disease. Keyword there. Oh, thanks, Shannon. I was trying to be nice about everything and explain the whole problem that this doctor created and with my husband's brain injuries and how this triggers him to behave this way. I don't want to have to use the law against Michael at all. I just want him to go away and get help for everybody and stop it. And Nancy needs to go the fuck away. That's all. That's all I want. He can quit hollering what do I want from him because that's all I want. And to take all that crap off the divorce papers and I will sign them without the judge. Damn. That's it. That's all I want. Doesn't seem too bad of a request. I'm not asking for a house, a car, a boat, a yacht, his money, nothing. Take that stupid shit off the divorce papers and I will sign the damn things. Fuck. Ooh. Interferon. You guys had asked about that. Here are some study results on that. Inhaled. Safety and efficacy of inhaled nebulized interferon beta-1 for treatment of COVID infection. A randomized, double-blind, placebo-controlled phase 2 trial. And this is published in The Lancet last month. Compared to placebo group, treatment group receiving inhaled interferon beta-1 had higher odds of improvement on the WHO ordinal scale for clinical improvement, which on day 15, which is just a way to easily graph progress. Higher likelihood of achieving, it's the OSCI is what they call that, score of 1, which means no limitation of activities during treatment. Similar odds of hospital discharge by day 28. Most frequently reported adverse event was headache, 15% in the treatment group, 10% in placebo group, psychosomatic. 3 deaths reported in the placebo group, none in the treatment group. So that's pretty good. The implications: nebulized recombinant interferon beta-1 treatment seems to be well tolerated and associated with higher odds of clinical improvement and recovery among admitted patients of COVID. But it's interferon. It's expensive. Still ain't talked about RLF outcomes on here. So it's hopeful, but not the significant change that we see with RLF. Key findings on 60-day outcomes among patients hospitalized with COVID-19. Nearly a quarter of admitted COVID patients died during hospitalization. 12.6% of surviving patients were transferred to a skilled nursing or rehab facility. So we know this is a long-term battle with COVID, guys. 60-day follow-up of surviving COVID patients revealed 84 died, increasing the overall mortality rate to 29% and ICU death rate to 65. That's not good outcomes. Not as good as I can see with RLF. 15% were readmitted. Implications: hospitalization may be just the beginning of persistent health, emotional, and financial hardships for many persons with COVID. Mental health assessments and social services should be part of the inpatient care team to ensure that these resources are immediately available to patients on discharge. That's very true. Long-term COVID. Long-term COVID-19. Let's see here. These are just like the descriptions of what the stages are. The vaccines, other topics, primary outcome. Hydroxychloroquine. I wish this drug would go away. Let's see here. Hydroxychloroquine, no events. Where is the damn explanation of this? I don't even know what the heck this is. This is just in brief. Talks about other topics. It's got the outcome, the risk ratio, clinical laboratory criteria. I have no idea what the hell. I'm going to have to go to the study. I have no idea what this was even. Can dogs smell COVID? Here's what science says. Persistence of evolution. A cluster randomized trial of hydroxychloroquine did not. Okay. An open label cluster randomized trial found that hydroxychloroquine did not prevent COVID. Obviously, Trump got it, so. But the standard of care to detect COVID currently is the PCR test. The antigen test is completely faulty. Here in El Paso, they used the antigen test to determine whether or not to have some football games, and 10 out of 11 tests were false positives. Big problem. We should be using those PCR tests right now until the antigen tests get better. A PCR test still really isn't perfect, but it's got less of an error margin than that antigen test does. But my biggest problem is the quarantine time. If somebody tests negative and they quarantine and become asymptomatic during quarantine and get out too early, they become a super spreader, because that viral load is really high right before they start showing symptoms. And that is when you are most susceptible to contract this, because they have more of that virus in their body. And your mask will lighten your load that you're exposed to. That's why it's important to wear the damn mask. When you look at science, it's logic and reason. It's been science. We've scienced the crap out of it. We're still doing it. But to have pressure from the president's office on the CDC to reduce the quarantine recommendations, we're doing it wrong, folks. We're doing testing wrong. Many of you are having a hard time even getting access to testing when you want it. Many states are giving it for free. They have the drive-through testing. It all depends on your state. This is why it is so important to put that freaking mask on. Please, I don't want you in my hospital. I I'm actually going to be in New York on Monday. We had to lengthen the time because of the, because we have to do the drug test. They have to go and verify all the licenses. But still, starting on Tuesday is great. That's fine. I've already got my room booked. I got my flight. I'm good. I'm going to be in a primarily black area, and I'm going and the Hispanics. That's probably all I'm going to see out there again. I don't want to see that. This is a huge minority group that is affected. They're not getting the education that they need to protect themselves. I don't know how to reach these people. Beach Gem 10 on TikTok is a ER doctor in Florida. She's a peds ER doctor, and she does some great short COVID education videos. She's got 100,000 followers now. I'm proud of her. She's on my friends list. I've personally messaged her, thanking her time and time and time again on every video she does. Like, thank you for doing this, because we have to get this information out there. It's they're short 1-minute videos. They're easy to keep somebody's attention who's younger. Minorities do use TikTok. I see them all over the place. So we are needing every social media platform to reach you guys. So when I get back on Thursday on my account, share the shit out of everything I have on my page, because we have to reach people right now. They are coming to us as healthcare professionals because they want answers, and they well should. And they're asking her good questions. They've asked about the fetal tissue and the vaccines, quarantine time, the vaccines. She's doing awesome job. Awesome. Freaking great. I'm trying to condense some of my information. I don't want it to be redundant, but I will do some short COVID videos on certain topics. So if you guys want me to touch on certain topics, send them to me, and I will focus on those things, because I am going off of what you guys are asking me. When I see the same question over and over and over again, like this one on quarantine, it's time to do a video. So that's what I need from you, is to let me know the information that you're not clear on. Let's see here. Our country is only testing right after contact, not testing on release. That is correct. It's not even recommended at this point in time, and that's a problem. I don't agree with that. I don't. Oh, yeah, that's right, Kimberly. Okay, I forgot about your situation. Her daughter came into contact with somebody at school, and she has to quarantine. Her other kids go to the same school, but are allowed to go to school. Do you see a freaking problem here? If she comes home and gives it to the other kids, even if she's quarantining, she's still in close contact. They're closed up in a house. It's cold. It's winter. They're not playing outside. But the other kids are going to school. What the hell? What the hell? Maybe that ought to be one of my first TikToks. Hang on. You're going to have to remind me on this, Kim, because I'm going to forget. But I'll do that one because, yeah. I'll have to figure out how to stitch a video. But yeah, health guidelines dismiss the rest of the family as potential spreaders of COVID. I have 5 kids in 3 different schools. Do you see a problem here? And we wonder why this shit is spreading everywhere, because we're not doing it right. Damn. I need you guys to take your situations to your local officials. Let them know, and your state senators, what the problem is. Because they're the ones who can make changes in your state and your testing guidelines. It has to start at the state level. It has to. And the city level. They have to know your situations, because, yes, there's something about this that is not working out okay. That's what's happening to my boyfriend, too. 2 kids are quarantined, but the other one can go. See? What state are you in? Oh, yeah. She's in Michigan. You're out in Utah. This is not good. In elementary, one should have been quarantined 7 days ago. She only has 7 days to go now. How can we do warp speed and lax testing? Yeah, we can't. We can't. This is what is wrong with this administration, this pressure. This needs to freaking stop. You can't keep people locked up in their house, number one. You need to teach them how to do things safely so we don't wind up in this mess. Education, facts, not fear. The media is inciting fear. Use the freaking media for the right purpose, to educate, inform, not cause fear. That's what my whole problem with Lawana's video was, is she caused fear. Probably, and actually she did delay care for people here because they messaged me personally wondering what they should do. Come on. I doubt they were freaking messaging Dr. Navoa. This has got to stop. Kids, yep. Much more professional than their 2 videos combined. I try to be. I really do. When it attacks my personal credibility and what I'm trying to do out here, I've had enough. Okay, we'll address it. We're going to move on. I'll deal with it behind the scenes. But this is going to stop. It is a waste of testing resources. Test at the end of quarantine. You are correct. Honestly, I think we should do beginning and end, because if you were... And get me the freaking saliva test. That's the answer. It's cheap. It's effective. And we're still not talking about that. Why are we not asking the right questions here? Testing... The right test, that saliva test, is like damn near perfect now. And they're so cheap. These other tests are expensive, and they want to be able to bill your insurance to pay for them. That just drives up our healthcare costs. That's the problem in healthcare. Cost. 50% of our GDP goes to healthcare costs in some way, shape, or form, whether it be essential workers, whether it be medications, insurance premiums, all of that. 50 freaking %. We could cure a lot of homelessness and a lot of veteran problems with that extra money that we are wasting in healthcare because of red tape and games. Not okay with it. 3.0, man. Health 3.0. What the hell? Kimberly, it's, oh my God, you just have to. TikTok is so great. It really is. It's honestly, it's uplifting and informative. I don't see much negative stuff. I see a lot of stories on there. There was a girl, I was watching her entire story last night, like all 18 minutes. She was somebody who wound up making the news for having a relationship with her high school gym teacher. So that was very interesting. And she was out there telling her story, and somebody got her videos taken down, but they came back up. But that's our story. You don't get to tell us how we get to tell it. And that goes for my husband as well. I'm not trashing him. I'm not out here calling him freaking names. I'm telling what happened. I mean... The evidence is right there. I'm not defaming you if I can prove it. It's not slander. If I can prove what I'm saying, it's not slander. And I share it. Just like I did in that video. People just drive me freaking crazy. Just like that idiot on TikTok who pronounced Janet Jackson's name Janae Jackson, and in sync he spelled out N-S-Y-N-C. All of us Gen Xers are like, oh, hell no. That boy needs to go. Holy crap. Who did? And he thought it was Janet. He thought Janet Jackson was Michael's mother. Yeah, great. Our kids are so freaking smart these days. We've had 4 positive cases in our store. We've all been exposed, but our company will not close. But yet you're supposed to quarantine. Do you see a freaking problem here? Do you? But we just keep cleaning and masking and hoping. Gladwood is closed down in Michigan. That's my... It's not my hometown. I grew up in Metro Detroit, but that's where I graduated from. I'm a Detroit country girl. Half and half. My doctor is diagnosed COVID. Son sent home because of sister. The kids sitting in 6 feet to stay home 14 days without telling families who was cause. Oh my freaking God. Okay, so testing is a huge problem here, and the quarantine guidelines. Thank you, Cheryl. I try to do everything I can to keep you guys informed. You know I'm not out here looking for money. I'm not going to charge people for this information. I want people to be educated with facts. I don't want you scared to live. That is my whole goal with this, to live intelligently so we can get back to life and get back to going to Walmart at 4 o'clock in the morning when nobody else is in the goddamn store like I normally do. I don't like being around people during the day. I didn't tell you my granddaughter had COVID. Her live-in boyfriend was told to quarantine. They both work at local hospital. The hospital tried to make him work anyway. These are all going to be comments on a TikTok video. Okay. There's going to be a part 1, part 2, part 3, and probably a part 4 to get through everything I have to tell you in a short period of time in a 1-minute freaking video. I need to hear your problems. You guys are not bothering me. You're not. I'm not tired of talking about COVID yet. Here we are again. I'm ramping up for the next round, man. It's like round 6 for me. I don't even think we're into round 2. We are still riding the wave of the first freaking virus because we never really flattened that curve. It should have been flat for a couple months before it picked up again, and it was not. It kind of all around the United States until we all got locked indoors. And we still ain't got this shit right. You gotta go get some rest, honey. But yeah, call the congressman, hit up high-profile ones like AOC. Yeah, call her ass. I have a question. A man at my church is on dialysis, and now they say his liver is failing. Is that due to low oxygen? And why are they saying he has COVID pneumonia? Isn't no. That's a good question. Okay, so the guy at your church is on dialysis. They say his liver is failing. The problem with COVID is the body has to fight so hard. This is a different kind of pneumonia. We thought it was like ARDS, acute respiratory distress syndrome. It's like a inflammation of the lungs, and they get really stiff with fluid, and I can't expand them to get the oxygen through the AC membrane. There's a membrane at the alveoli, and it transmits the carbon dioxide out and the oxygen into the blood. That becomes impaired. And what happens with the body trying to fight this, and there's another lady whose mother, she was on the news. Her and I are in very close contact. So my video and my news interview did bring people to me who really are looking for answers. And I talked to this woman and asked her how her mother's doing every day, because the doctor wanted them to take her mother off the ventilator. And her mom, I don't feel, by looking at her vent settings and her vital signs, yeah, she has some up and down days. They have to bump the oxygen up and they get to come back down. She's waking up. They have her on some sedation because she gets agitated. But I don't see high pressures on the ventilator. She's really not on a crazy amount of PEEP. That tells me that she needs to be taken off a vent. No, it tells me she needs to be given some time, because this does take time. Look at all the people who have to go to skilled nursing and rehab after this. But with the body fighting, it begins to shut down other systems. A lot of times the kidneys begin first. I quit seeing urine output. We have people on dialysis like this guy. So his kidneys are already failing. Now his liver is beginning to fail. So we are going into multi-system organ failure. He's probably not going to make it, honey. If he's already on dialysis. Was he on dialysis prior to COVID? Is another question. But seeing multi-system organ failure, this is a big signal. Now, her mother that was on the news she's not going into organ failure. I've asked her certain specific questions to ask the doctors so that I can better answer her questions. And she'll send me, because they actually have something pretty cool at the hospital. You can log on and see your parents or your relatives' vital signs, vent settings, who was notified. That's an awesome thing, because what happens is it takes the nurses away from having to sit on a phone to answer questions that can actually be answered through a computer most of the time. And then if they have any questions further than that, they can call and talk to the nurse, but that gives the nurse more time to interact with the patient. So that's a good thing. COVID did it. Okay, so it's still not a good thing. When I was out in New Jersey, and you know what happened out in New Jersey? We ran out of dialysis fluid. It was on back order. So those 2 patients that I was referring to, the 19-year-old that I sucked the plug out of and the nurse, neither one of them were able to get dialysis for almost 3 days until we got the fluid in, and they swelled up so bad. It was so bad. It was so sad to see. It was. But it starts to shut down systems. So they begin to do dialysis because the kidneys are shutting down. They're not getting rid of the waste. Now his liver is shutting down. And COVID pneumonia is different, we have found. And that's what we were doing damage with our ventilators, trying to treat it like regular ARDS, because it is not. And actually they are calling it CARDS, so it's CARDS. It's COVID pneumonia, because normally a pneumonia does not spread equally across your lungs. we see it in like 1 or 2 lobes. It's asymmetrical. COVID is pretty much symmetrical. It just inflames everything. So it is very different from normal ARDS. So they are correct. Let's see here. I'm trying to... Yeah, so that's why they're saying they have COVID pneumonia, because that's the particular pneumonia that comes with COVID. It is specific to COVID. We do not see this with any other virus. It is not the flu. That is how the virus is not the damn flu. Look at how long these people are on vents. 6 to 8 weeks, sometimes 6 months, if they even get to come off. I don't get that with the flu. I don't get mucus plugs like that with the flu. They're pretty dry. Once the inflammation goes down, whatever got trapped down there that's discolored, because it's the enzymes that change color from being trapped. They become old and dead. That's where the green and yellow stuff comes from with the pneumonia, is from the enzymes changing colors from it being trapped in there in the alveoli for so long, because it squeezes your air sacs shut. So they can't expand like a little balloon. Think of trying to blow up a really hard water balloon. Like, give it to a kid. So that's kind of like what my ventilator is doing. I can't pop them open without causing damage with those pressures, and we were. So we stopped doing that, and we're going with really low volumes, but we still can't recruit those alveoli. That is the problem with this. And then you have the microemboli. I can't get oxygen through blood clots. I can't. It's blocking the way. So that is all the complications that we are encountering with the COVID. Our governor was on today and said we are short-staffed and short people. Yeah, see, I turned down a job in Michigan, guys. I really could have seen my son, but unfortunately the fucking donkey cost me time with my son, and now I'm pissed and I'm coming for your ass. You have poked the wrong fucking bear. I am taking the New York assignment just to go deal with her ass, but I could have been at my brother's house 5 miles from the damn hospital I used to work at and seeing my kid, who is really struggling right now. So I am ready to choke this woman. When I get out there, I'm going to be on the horn with that lawyer ASAP, because I am done. You freaking cost me time with my kid, bitch. Coming for you. But yes, they are short-staffed in Michigan. Actually, the hospital that I was at in Grand Rapids, Mercy, they reopened their Hackley campus, which was closed down. And I got care there when I lived there, so this was just recent. But they reopened the Hackley campus so they have more room to treat people. But we don't have staff. I had so many job offers and so many choices of where to go. I want to go back to New York, obviously because of Donkey, but because of the area I'm going to, I always try to work for a nonprofit in an inner city hospital, because that is the patient population that means the most to me. I am not self-serving. I don't give a shit what my husband said. That is the least self-serving thing to do, is to go help minorities. I don't want to work at a private hospital with people who got health insurance. They also have a sense of entitlement. These folks are genuinely appreciative of everything you do for them. And I did educate. When I worked in Flint, I was known for handing out the applications. I used to carry a clipboard. It was stuffed with applications for the medications that these people need to be on a daily basis to control their asthma symptoms. They didn't have health insurance. I'm like, you don't need it. You can get it from the drug company. The doctor will sign the form right here. You mail it in, and they will send it to your house. I quit seeing a lot of my frequent flyers when I started doing that, because I gave them a source to get their medication. I gave them answers to help solve their problem. That is the least self-serving thing in the world to do. So the attack on my character, I do take personally, because that is what I do for people. That is what people don't see. But my patients do, and my patients are appreciative, and that is all that matters. And my supervisors know what I do. So we're short-staffed, so they are behind on quarantining people. Yeah, they're not also contact tracing to figure out where this is at, so they can't contact people who've came in contact. Dude, we have no people. All these people in this population of the United States, and we don't have enough staff. Do you realize in Laredo we had Filipino nurses coming in from the Philippines? We're going to need to recruit from other countries, guys. Canada's probably going to have to come in and help us. This is not good. Restaurants are suing the governor because she made it takeout only, no dine-in. I don't understand people. That's what we are here in El Paso. There is no dine-in. You can't even sit at McDonald's. You can't sit anywhere. It's all takeout. Those restaurants are still able to stay in business, and the Uber drivers are getting paid because we're the ones out here delivering the food. It's helping keep people employed. So there are answers to the problem. Just because you can't go out doesn't mean you can't make it a romantic meal at home. Get creative. Get off the damn television. Shut CNN off. Shut Fox off. Shut all the damn news off and go interact with your family and family game nights, family dinner. There's answers. You can do alternative things. You just don't wanna because you're being told no. And you all know I lean conservative, but I support the Democratic governor in Michigan, and I have. That's what that viral video was all about, was how she was being treated. She's in Michigan, Maddie. See here. Does prednisone, yes and no. I mean, it does, but not as great as Decadron. It does not have the same results in the studies as the Decadron. You should be using Decadron. But yes, they are prescribing prednisone. We see better results with the Decadron, but some doctors love their freaking taper packs. But Decadron's cheap. Why are we not using the cheaper drug that's been shown to work? But yes, it is a steroid. It does help. Does COVID pneumonia always... That's another good question. You guys are on a roll tonight. Thank you. Does COVID pneumonia always... COVID and pneumonia, are they always together, or can they come weeks apart? Yes. It all depends on the progression of your symptoms. Generally, by day 10, we know how severe it's going to be. Some people go to day 15 before it gets bad. Some it's around day 13. But a lot of times those symptoms in the beginning are just nausea, vomiting, headache, fever. Then the COVID pneumonia comes later on. We don't understand quite yet why this virus progresses differently in some people. It could be our immune system. It could be our blood type, research, and science. But yes, it does. It can come separately. You can have a clear x-ray in the beginning. 2 to 3 weeks later, yes. I had a lady out in New Jersey. She tested positive. It was asymptomatic. She went home. 6 weeks later, she came in severe respiratory distress and died 5 days later. We're all standing around going, and when I wasn't kidding, when we were losing half our patients by lunch from situations like this, I would go by a room. I'm like, what happened to the patient? Oh, they passed away an hour ago. What? And she was in another room. And then I lost another patient. I'm not killing my patients. COVID is killing my patients. Michael Huffman, how dare you? I don't sit here and tell people that you're killing your soldiers due to your poor leadership skills, because that's the equivalent of what he's done. And don't think I won't be making that argument in court. Does prednisone... Okay, we already answered that one. My former roommate has Lyme's, fibroids, and is going through change. Her hemoglobin is 6.7. Is she conscious? I know Maddie and her family's runs low, but that's pretty low for hemoglobin. Hematocrit is 19. They are going to transfuse and send her home straight away. I mean, yeah, get her out of the environment, but make sure she's stable. I wouldn't be sending her out. I would actually, if that were me, I mean, you ain't sending me freaking nowhere. You're going to keep me a few days and figure out if this is going to drop again. I don't want to be at home when it happens. A 6.7... What? Her doctor wanted to do a video appointment on Friday. Our doctors, a lot of the primary care doctors are getting sick with COVID. Anthony on Be the Change, Dr. Frank, he got sick. My dad's doctor got sick. And some are still struggling. And they're older. They're in fear. It might be a suggestion to get a second opinion on that one, which is what I had my dad just go get a whole new doctor. I helped line him up with a new doctor. It's true. Some of these doctors are scared because they're at risk. They have high blood pressure. They have diabetes because us healthcare workers set really poor examples, myself included, smoking, with our diet, lack of exercise. But it's because we give so much to our patients that we don't take care of ourselves. And that's the truth. And we need to start loving ourselves as much as we love our patients, or we're not going to be in a condition to love them anymore. We're going to be up there enjoying the ones that passed. I told her to go to it. Yeah, that's a really good idea. And you're a nurse. You already know that that's not acceptable. MD is calling up the Medical Volunteer Corps, bringing in retired doctors and nurses. So is New York. It's going to come down to the military, guys. And Mickey made a good point today. A lot of our National Guard members are already employed at hospitals, so they can't come out and leave the hospitals that they're currently at to come help you. That would make no sense, right? Our active duty soldiers are going to have to come out. That takes them away from the Army hospitals and the veterans who need their help. Do you see where I'm going with this, where this is becoming a big problem? Yeah. My daughter had pneumonia about 3 weeks ago. Last night, COVID test. This morning, positive for COVID. So she had pneumonia, wasn't COVID pneumonia, 3 weeks ago. And the reason why she probably got COVID, Rhonda, is because her immune system was compromised trying to fight and recover from the pneumonia. When I get pneumonia, which it's probably been, well, I haven't got pneumonia since I got my flu shot. When I went into medical, it was like 2010. Well, in 2009, because I had to get it for school when I did my clinicals, but I haven't gotten sick since then. Not even nothing more than a sinus headache. But her immune system is compromised, but it used to take me like 6 weeks to fully recover from the side effects of having just regular pneumonia. So your body takes a huge hit. So this was the whole problem why we wanted to get this under control before it spread like this, the way it's doing now. Because if people do get the flu, you're more susceptible to get COVID, and vice versa. Not just the flu then COVID, you can get COVID then the flu and be double compromised. So now her immune system is taking a really huge hit, and her body's really going to have to fight. Incentive spirometers. She needs the incentive spirometer, keep those lungs open, and she needs to self-prone now. If she's already had pneumonia and now she's got COVID, the COVID pneumonia could be worse. You really need to move that fluid. When we get laid up in bed, the fluid settles where gravity does. Just like rigor mortis, you see the blood pooling that happens with the lungs too. So everything's on your back. Well, then when you ask people to prone, they complain, oh, it's uncomfortable. It's going to be really uncomfortable when I do that to you while you're on a ventilator. Because we have to do it by hand if we don't have rotoprone beds, which in the majority of hospitals, we do not have them. And if we do, we don't have enough. So it takes like a team of 6 or 7 of us, depending on your size, it could be more, to flip you upside down on a freaking vent. Then I got you drooling everywhere, laying in your own freaking secretions and snot, and don't make me do that. I don't like to do that. Do it at home and quit your bitching. Once you've prone and that fluid starts to move, that pressure begins to ease up after a while, and it makes it easier to breathe. But I need you to lay face down. I don't want you on your side. I want you face down. Move that fluid through the lungs. If you lay on your side, you're moving it to the side of one lung. I need you to disperse it evenly throughout the lungs. And the only way to do that, and that's the only thing you can do at home to really help yourself, is to lay face down. Prone yourself. Move the fluid. Don't let it settle. That's really important. We know it's super important. Z-Dog's got a great video of tummy time for adults. We call it tummy time in the NICU for the babies because for the same reason. But now adults have tummy time. Only it's a lot harder to flip your ass over on that damn ventilator. Stop it. Don't make me do it, please. So what all can COVID damage later effects? Okay, because the ACE2 receptors were COVID binds to, we also know the CD147 cells. I have not been able to do much more research into that. I have not been on my page because it pisses me off. I can't comment. 1.5 days left, folks. I am counting down. But because the ACE2 receptors, they're found in the guts, the kidneys, the liver, everywhere. So all the areas that ACE2 receptor can be found can be damaged by COVID. People have lost their intestines because of this. You don't hear much about it. It's not common. It can happen. So the liver, the kidneys, the heart. Okay, the heart is a big one. The heart and lungs work together in a pumping system. The heart pumps the blood for the lungs to oxygenate and and move the carbon dioxide out. If one system's compromised, it impairs the other, whether it be the lungs or the heart. So yes, it can damage multiple organs, and that's why we go into multiple system organ failure. So it is really important to straighten our testing out and to protect yourself. So if you know that you tested negative and you're not getting a test afterwards, and then you come down with symptoms, you are spreading it. So we need to contact our local health officials and tell them our stories. Let them know, because without knowledge is power. Without knowledge, you really can't open your mouth to talk on something if you don't have the knowledge to do so. And if you don't have these stories, then you don't know. So we are responsible. That is our social responsibility, guys, as voters, as citizens in this United States of America, to let them know, because they can't help you unless they know. If you're not reporting it, they don't know. So we need to take some personal responsibility to take that 5-10 minutes out of our really busy quarantine day, get off TikTok, and report it. Yes, I have a smoker's cough. I need to stop this shit. Hopefully, when I get to New York and cigarettes are $15 a pack, I will quickly lose my urge to smoke, right? Yeah, very much so, because I ain't taking cartons with me. So yeah, we really need to focus on testing and the guidelines. And the CDC never comes out and does press conferences when they make these guideline changes. And that's a problem, because they don't explain why they did it. And then we have confused people. Common sense. Common sense is dead and buried, and common decency is on life support. Remember that quote? Yeah, it very much is. So we need to use this time wisely and to protect ourselves and wear that freaking mask, because it does reduce the viral load. The questions I want you to ask your local officials and your state senators are, why are we not talking about saliva tests? Why are we not talking about RLF 100? Why are we not talking about testing issues like this? Those are the 3 main topics I want you to bring up to them. And then explain what happened. Explain the school situation. Because that's a problem. That is a spreading risk. And we're trying to mitigate our risks of spreading. Why would we do these things if we're trying to reduce that? And those are 3 things that we can do to do that. And then educate. We're not educating. We're not. We're spreading facts, or fear, not facts. And like I said, with Luana, that UMC press release, I don't feel bad for doing my video, because I did my research. Look all the crap that Z-Dog gets backflacked at him. Just hate. The anti-vaxxers downvote his videos all the time. But you know what the funny part is? It's a reaction either way to the algorithms on these platforms. They don't give a crap if it's positive or negative. People are reacting and commenting. That's all that matters. So you're just bringing in more viewers. Who cares what they have to say? They're doing you a favor, because they're putting your video in other people's news feeds by their bullshit reactions. Perspective, folks. You got to keep perspective with this. But I will not have my character assassinated without going on the defensive about this, because, oh, hell no. I've tried too hard. I have taken up so much of my time to do this. And he might be a very respectable doctor in his field of practice, in what he specializes in. I don't treat very many pregnant women. I really don't have much to say about it. Yes, they're getting sick. Yes, their babies are getting sick. Yes, the workers are getting sick. That's all I can really speak on about that, and that they do get sick. So I don't care what he has to say about that. I care what you have to say about me without talking to me first and making liberal assumptions that you use to defame and inflame my husband's, it's a disability, which in turn causes me stress. I've had all of my stress manifest in my guts. Since this happened, I've not been able to eat solid foods again. I've been back eating the soup that I had like 13 boxes of in my ex's pantry that I went home for to get, that his friend bought me because he wanted to get me something that I wanted, because I do things for everybody else. You know, that friend that had so many negative things to say about me. That's how concerned he was that I had something I liked. But I've been nothing but water coming out of my guts. I can't eat. Even though I try to meditate and de-stress, my body turns it into a physical reaction. And this was what my entire marriage was like. And I swelled up to 185 pounds. I currently weigh 150, which is what I weighed in high school. That's what stress does to me. That's what he did to me. And I'm not going to put up with it anymore, because that is abuse. And you always speak up for yourself, especially when you're right. And I don't care if it's the unpopular opinion. You guys have learned that by now. I will speak up. I don't care, because I called it with Black Lives Matter when I was watching it in Laredo and all the fires were going on in New York. Which, oh shit, I forgot that's where I'm fucking going. Great. Forgot about that. Pray for me. Son of a bitch. Yeah. You are very welcome. I'm going to let you guys go. We've been talking about this for a while. I hope I answered a lot of questions. I know you guys had a lot of them. And we're going to have more. But feel free to ask them. I am here. I do not mind answering them. You can send private messages all the freaking time. Okay? All right. I'm going to attempt to go find something to stick. I did try a peanut butter and jelly sandwich, but fuck, my stomach hurts. Nothing stays in it. And I don't want to put too much in it and just have more misery in the bathroom later. This is going to stop. My lawyer did try calling me a few times today. It was a blocked number, so I didn't catch it. My fucking divorce judge is retiring, which sucks because he was the one who heard our last marriage, or his last marriage case. And so they're not setting any new dates until after the first of the year. I hope it's a female. But, so he's going to be married quite a bit fucking longer. Great. Oh well. I offered to his lawyer, you take that shit off that fucking paperwork and I'll sign it. But it's to the point now where I want a judge to look at the evidence and go, I don't fucking think so. Because I don't want him coming back going, you know what? I agreed to it just so she'd sign the papers, but that doesn't mean I will make him sign a statement retracting all of that before I sign that shit. Because that is why I am fighting this. It's because I want it off of there because it's not factual. He catastrophized. So, yeah, that's what's going on. But in the meantime, I'm going to have my lawyer deal with this fucking doctor, too. I did let him know that I sent a cease and desist letter out, which certified and registered with a return signature. So, if he sends it back, knowing damn well I'm sending it, that's just going to look even fucking worse in court for him. So, I'm going to sick my lawyer on his ass. All right, I need food. Talk to you guys later.